Welcome to our video on malignant mesothelioma. Let's get started. Here is our overview slide. Let's begin with some general characteristics. Mesothelioma is a malignant tumor originating from mesothelial cells. Mesothelial cells are cells that line body cavities, including the pleura, pericardium, peritoneum, and testes. For the purpose of this lecture, we'll be discussing malignant mesothelioma affecting the pleura. It occurs due to asbestos exposure, and those especially at risk include plumbers, carpenters, electricians, and insulation workers. The clinical features include dyspnea, cough, and weight loss. It can also cause bloody pleural effusions. Patients will have a history of asbestos exposure, and on imaging, pleural thickening can be seen on a chest X-ray as well as CT scans. This is a CT scan of the chest of a patient with left-sided mesothelioma. Notice the extensive pleural thickening and contraction of the left hemothorax. On pleurocentesis, bloody exudate can be seen. A biopsy will show mesothelial cells, asbestos bodies, psammoma bodies, and calretinin positive cells. Here is a histological image of mesothelioma showing calretinin positive cells. Here is an image of a cytopathology specimen of malignant mesothelioma cells in pleural fluid. All right, let's try a question. A 69-year-old man presents to the clinic due to shortness of breath after working in the yard for long periods of time. He denies any significant coughing or unintentional weight loss. He has never smoked in his life and will occasionally have a beer on the weekends. He also mentions that he worked as an electrician all of his life but retired 4 years ago. Based on this patient's most likely condition, what is the expected finding if a chest CT were to be performed? All right, this patient has most likely been exposed to asbestos due to his work as an electrician for all of his life. However, since this patient denies significant coughing and unintentional weight loss, he is unlikely to have a neoplasm of the lung, such as malignant mesothelioma. It's important to know that the most common manifestation of asbestos exposure is benign pleural plaques, which are lesions of scar tissue that may be calcified and can be detected on imaging such as CT. These are usually found as patches on the lining of the rib cage or on the diaphragm. Most patients with asbestosis are asymptomatic for long periods of time, then present with exertional dyspnea as the condition progresses. Patients with a history of exposure to asbestos are much more likely to develop benign pleural nodules than malignant mesothelioma, and this is a frequently tested point. The treatment includes radiation therapy with or without chemotherapy, and pleurectomy surgery can also be performed. All right, let's wrap up with a final question. A 68-year-old man presents to the clinic with progressive shortness of breath during normal daily activities. He also admits to symptoms of constant coughing and a recent unintentional weight loss of 10 pounds over the past several months. The patient mentions that he worked as a carpenter for 45 years and only retired recently. A CT scan shows extensive pleural thickening. A biopsy of the lesion would most likely stain positive for which of the following? A. Calcitonin, B. Calretinin, C. Synaptophysin, or D. Chromogranin. All right, this patient has the chief complaint of progressive dyspnea with the associated symptoms of constant coughing and unintentional weight loss. He also has a history of working as a carpenter for 45 years, which means that he most likely has been significantly exposed to asbestos throughout his life. His CT scan shows extensive pleural thickening, which when added to his symptoms and work history means that this patient most likely has malignant mesothelioma. This is a malignant tumor that originates from mesothelial cells, which means a biopsy would most likely stain positive for calretinin, which is a protein found in tissues of mesothelial origin. Therefore, the correct answer is choice B. Answer choice A is incorrect because calcitonin is a hormone produced in the thyroid gland to oppose the actions of PTH and is not associated with mesothelioma. Answer choices C and D are incorrect because synaptophysin and chromogranin are markers of neuroendocrine cells that are associated with medullary thyroid cancer as well as small cell lung cancer, but not mesothelioma. So again, the correct answer is choice B, calretinin. And that concludes this section.